patients expect after a nerve root block?
So nerve root block is a minimally invasive pain management procedure where, under image guidance, usually X-ray, we identify the nerve root and we put either a probe, radiofrequency probe, or a needle down to the nerve root, and we're going to treat it essentially. And we usually treat it with local anaesthetic and steroid to try and reduce the inflammation. With the radiofrequency, we use a non-destructive electrical treatment. Now, if patients have undergone a nerve root block, often we use local anaesthetic within the block. So it's quite common after the block to have some residual numbness in the area. So, for example, if somebody has a disc prolapse, for example, you do a nerve root block at, let's say, L5, S1 at the bottom of the spine. After the nerve root block, they may have numbness in the foot, at the bottom of the leg. That may last for several hours. They may then have a bit of tingling, a bit of heat, that sort of thing. And that may go on for the duration of the local anaesthetic, which may be several hours. It can occur up to a day, even a couple of days is can happen. The most important thing is that that effect from the local anaesthetic is temporary. The local anaesthetic will wear off, it's not going to be there forever. The main problem after that is that patients may have some discomfort, usually at the site that's been injected, so that can feel sore in the back where the injection's taken place. And they may have some irritation of the nerve root that's been injected. So obviously we're doing the procedure to try and calm the nerve root down, make it less reactive, reduce the inflammation, but the action of actually injecting a solution of local anaesthetic and steroid and maybe radiofrequency if you use it, you can actually irritate the nerve. So some patients will get what we call post-procedural discomfort. So they may have some discomfort or discomfort around the nerve for a couple of days, 2-3 days after the procedure, but they can have it up to 2 to 3 weeks after the procedure. Generally speaking, it will settle down. They may need to take some anti-inflammatories or some other painkillers for that duration, but generally it will settle. If they've got post-procedural discomfort where the injection's done rather than in the nerve itself, let's say where the needle has actually gone through the skin, we tend to suggest patients use cold packs. I mean, you can use ice packs and that sort of thing, but what's a bit more easier to use is, from most pharmacists, you can get chemical cold packs which you sort of break and they go cold and you can put it over the area. So we tend to use that quite a lot.
Thank you for watching, and thank you to everyone at the London Pain Clinic. If you would like any further information about what you've seen, or you'd like to make an appointment, please visit the website www.londonpainclinic.com.